afternoon, all. I'd like to welcome you to the November Alliance Behavioral Healthcare Board meeting. Good to see you all once again. We do have a number of announcements for you today, so I'd like to get started with that. First, it's good to see that we've grown a little bit, even since the last meeting. That's good. We're having a lot of growth, and our communities and counties are coming together. I'd like to take the opportunity to welcome Adele Posha to our board and to around the table. If you all remember, we spoke with Adele last month, and she was appointed by Wake County to our board. So welcome, Adele. Glad to have you with us. Also, County Commissioner Carolyn Sullivan was also appointed to the board from Wake County as well, but she couldn't be with us today. Also, I'd like to welcome Senator Mike Woodard, who is with us this afternoon. I'll tell you a little bit more about him in just a few moments. He's going to be assisting us.
All right, sorry. We have several staff changes that we'd like to share with the board. We have a new executive assistant. Raise your hand, Veronica. So this will be the person who is important to the board and my executive assistant. She has been working with our agency since July and has just been recently promoted. We're delighted to have her, and I think she'll take care of all of you much better than I have. So we're looking forward to her starting very soon in this new job. And sad to say, we are losing Tracy Hayes. I want to definitely recognize her. She was before you last month doing a training on legislation, Chapter 122C, and we certainly are going to miss her as a part of our team. But the good news is, as I've shared, is that she's going to stay in the mental health system. We're not losing her for the MCO. She's going to go to Smoky Mountain. So she and her husband are relocating in that area. So with that, I do have one more announcement I'd like to make while I've got the floor, and that is for those new board members who can, we would like to invite you to meet with our senior management team on Thursday. On Thursday, November the 21st, and we'll start at 9:30 that day. If you will let me know if that is a good day for you to come. If not, especially since we have 3 new board members in the Cumberland area, then we may do something in that area if it's not. And I'll send out a reminder on that. And then one final thing, announcement is I am going to be making a presentation to the Cumberland County Board of Commissioners on Monday, November the 16th at 6:45. So if those of you from Cumberland County, if you can attend that meeting, will certainly be good. And we will be talking about our local business plan and our RFP process.
You say 16?
Yes, sir. That's the right. So those are the announcements. You want me to talk about that as a council? Orientation. Well, the orientation is part of the meeting that we'll have with senior management team, and we've got briefing books and we'll have that.
Board members, also, as you know, each year the North Carolina Council has a conference in Pinehurst that's held in December of each year. This year will be December 11th through the 13th. Once again, you all are invited to attend that. If you are interested, please pass your information to Veronica. So Veronica, that's your first, you might be getting your first request. So again, if you are interested in attending December 11th through the 13th, please pass your information along to Veronica.
And we'll send that out in an email as well.
Could you also send her number so that we can have it to respond?
Sure.
I'll put that in the email.
Thank you.
Okay.
With that said, Tracy, on behalf of the board and the board members, we appreciate your service. I'm not sure where the time has gone. It's just been so quick, but we're definitely going to miss you. We know what a great person and an experienced worker staff member that Smokey will be getting you in this area. But glad to know you'll still be in the area.
Thank you. Thank you very much.
With that said, board members, are there any agenda adjustments needed today? If not, we'll move into the oath of office for our new board members. It has down that I will be performing I will be administering an oath that is not correct. According to the appropriate or respective statutes, it's required that a notary or elected official perform the oath. So Senator Wood has graciously agreed to be with us today. He will be performing the oath of office for Chris Bostock, Kenneth Edge, Adele Fosha, and Lois Frosty. So we thank you for being with us.
And all of you, you can't, what, we were just going to
Raise your right hands and repeat after me, and I'll call each of you to say your names. I,
Kenneth Edge. Chris Bostock.
do solemnly affirm
Do solemnly affirm
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the constitutional laws of North Carolina,
and the constitutional laws of North Carolina.
so help me God.
So help me God.
I do affirm
I do affirm
that I will faithfully and truly execute
that I will faithfully and truly execute
my duties as a member
my duties as a member
of the Alliance Behavioral Health Care Area Board,
of the Alliance Behavioral Health Care Board,
according to the best of my skill and ability,
according to the best of my skill and ability,
and according to law,
and according to law.
so help me God.
So help me God.
Congratulations.
And congratulations to our new board members. We're glad and grateful to have you all with us. That's official.
Yeah. Did you get the
Board
sign
members,
up?
we'll move to item number 5, public comments. We do
Did you sign up
have
out there?
a few public comments this afternoon, this evening. I'd like to welcome those that have signed up for public comments to stand. Please state your name, your address, and then make your public comments. I'll start with Mary Short. Also, in addition to that, our statutes say that there's a 2-minute time limit on public comments, so we ask that you stay within that time period.
Well, it's almost my name is Mary Short, 365 Old Wilkesboro Road, Taylorsville, North Carolina, 28681. That is in the Smoky Mountain Center, LME region. And so I guess one of the things I will say is I am horrified to discover that Ms. Hayes will be going to Smoky Mountain. The reason I am here, can I ask who on the board is a CFAC representative? No one on this board today is a CFAC representative? Okay. I am here to address the relative as provider policy that is posted on your website, and I hope that as board members you all stop and look and read it. Because I only have 2 minutes, I'm going to get right to the point. This is National Family Caregiver Month, and President Barack Obama even issued a proclamation regarding that. So I think your policy that you have posted is an incredible slap in the face in light of that. It also has some incredible misstatements. I'd hate to call them fraudulent representations, but it under the innovations waiver, relative as provider, if we are denied by your organization to work, we have the right to file an appeal to Office of Administrative Hearings. And Ms. Hayes was at a hearing on October 10th, a telephone hearing. So she is very aware that the judge said we have a right to file a hearing at OAH. But I know that the LME MCOs are relying on some sort of a guidance from DMA. I think it's MCO Bulletin 8. I don't know if it has a letter or a number after it. And there's a chart on there that says if the relative as provider is denied, that they will be given a grievance notice. I think as board members, you should ask to see all the grievance notices that have been sent out to the relative as providers who have been denied. My understanding from Doug Wright is that you deny, Alliance denies about half of the applications. So I really, really want the board to pay attention to this relative as provider issue. The policy on the website states that even if we are approved to work as a provider, that the service agency is to continuously look for unrelated staff to replace us. So I'd like to remind you of the July incident where an adult male was left in a van. Oh yeah, that was by unrelated staff, not related staff. So I'm begging this board to pay attention to what is happening at Alliance in regards to family members as provider. And as I said, Ms. Hayes was at that OAH hearing. She heard the judge. I don't understand why this fraudulent representation is on your website.
Thank you so much, Ms. Short. Next, we have Diana Wyden.
Yeah, actually, Diana Wyer representing Fellowship Health Resources, and we were asked today to come to do a little overview of our agency. So I'm actually going to turn it over to our current CEO, Joe Back.
Thank you. Actually, I'm not the current CEO. I've been with Fellowship for 39 years. Started with the very first program in Rhode Island. We're currently in 7 states. One of the states that we're in is North Carolina. As of July 1st, and by the way, we came into North Carolina in 2007. Right now, one of our main locations is 5509 Creedmoor. And we provide mental health and substance use services. A year and a half ago, I hired a new CFO, Deborah Paul. The board of directors went through a succession planning process and ultimately appointed Deb to be my successor. So one of the reasons that Carlisle Johnson asked me to be here today, I think, was to reassure people that the quality services that you've come accustomed to receiving from Fellowship will continue. We have a very orderly transition process. Diana Wideout is the regional director for Fellowship Health Resources in North Carolina. Pamela Daisy is our chief operating officer. And we're just delighted to be providing services here. I'd like Deborah to just come up and speak a little bit about her continuation in support of the things that we've been able to accomplish here. So, Deb.
I would just like to tell the board that we've enjoyed our relationship with, in Wake County with Alliance, and highlight the fact that FHR as an organization, our goal is to bring the improved quality of life to every individual we serve. And how do we do that? We do that because everyone that works for FHR believes in recovery for the individual, and we understand that recovery is different for each individual that we serve. And also their journey to recovery is different. So we meet them where they are when they first start receiving our services and help them along the way, every step of the way, customizing our services to what their needs are. That's why we've been successful in 7 states. We have success stories all over in our 7 states, and we enjoy working in the Wake County area. So thank you.
Thank you. Also, we have Pam Daisy. I'm not sure.
I mean, pretty much, Joe and Deb have said it all. You know, we have had a good working relationship with Alliance, and appreciate the collaborative relationship that we've had since being here in North Carolina, and look forward to what we're doing in the future with you.
Thank you. Thank you all from FHR for joining us this afternoon, for your comments. We definitely appreciate it. Ms. Short, thank you for your comments as well. It'll be something that the board will take a look at and review at a later date, so thank you very much for your comments.
I believe there's someone else signed up for public comment.
I'll make allotment for one other comment. We didn't have anyone else sign up for comments.
Hi, I'm Mildred Miller. I brought a picture of my daughter Janelle Albany, who's very sick today. I'm one of the families that has been affected by the relative as a provider, and I have gone to an OAH hearing for my daughter Janelle Albany. She's 32 years old. She's visually impaired. She has cerebral palsy, and she has a blood disorder. I would like to know from Alliance, where have they found the best practice model to say that it is okay to allow strangers to come in my home and work with my daughter? I have had outside staff for Janelle for many years, so I understand. I understand the battles of families when you hire outside staff. And I'm looking for Alliance to put that on their website. Where is their best practices model?
Thank you so much.
Thank you.
Thank you so much for your comments. Again, we will take a look at that at a later date. Please note that also, in addition to your comments, based upon the areas that you stated you reside, Alliance's catchment area does not necessarily meet or having input in the areas where you receive services or your family members receive services. So I'd like that, please, to be taken into consideration.
Wow.
Board members, prior to our training, we had a finance committee meeting. And I'd like to ask George to give us an update of items that were discussed, even though Sarah may have went over some of those items. I think there was a little bit more that was discussed in the meeting.
Thank you, Mr. Chairman. The Finance Committee met today at 2 o'clock. We normally meet just before this meeting. A couple of things. There was no action. We bring no action items to the board at this time. I would like to state that the quarterly financial statement that we received, that is for the end of September, first 3 months of this fiscal year. If you remember in Sarah's presentation, I believe at that particular time, as of 6:30, we had a negative unrestricted net asset. As of 9:30, that number has moved and is now a positive number. She also, as I looked at, really with some of you that were not here during her presentation, the audit is complete. We received what will be called a clean audit. We also met all of the standards set by the state. All of the financial standards set by the state. In fact, we exceeded all of them by a satisfactory margin that ensures our continued financial strength and growth of the organization. The other positive thing that came out of that meeting is that the state is only behind 1 month in funding. We're glad that we're moving in that direction. Mr. Chairman, those are my comments.
Thank you, George. We'll accept that report as information. Moving down to item number 7, you should have received in your board packet item number. I'm sorry, I'm not sure which agenda you have. Item number 7, Consumer and Family CFAC report, as well as the Executive Committee report. Are there any discussion needed for those 2 items? If not, I'll accept the motion to approve.
So moved.
Is there a second?
Second.
We probably moved and seconded to approve the committee reports. All in favor? All opposed? Moving to item number 8, the consent agenda. You'll see the draft board minutes from the October 3rd meeting. Does need to be posted in the consent agenda for any discussion.
Move.
It's been properly moved and seconded. Any questions? All in favor? All opposed?
Yeah.
Thank you so much. We move to item number 9, and Ella's going to provide to us an update on the Secretary's Medicaid reform.
There's been lots of activity this week, as a matter of fact, and I'm going to ask our board member, Ann Ackland, to help me with the press conference that was held today. But before we go to that, I'd like to share with you some information that we received regarding a meeting that Governor McCrory held at the mansion yesterday, along with Secretary Voss and other members of stakeholder groups. So if you will just bear with me as I go through these comments. Basically, he was trying to discussing with the group that was there the priorities of his first year in office. Among those priorities was Medicaid reform, as we all know. At this time, he is projecting, or the state is projecting, a $530 million shortfall in 2013, and a projection of $200 million in 2014. With the stress that they really understand that they really need to get Medicaid spending under control, because obviously that's impacting everything else in state government. The Secretary discussed about the fact that she's gone around the state and really has listened to stakeholders throughout the entire state, and is wanting again to look at the Medicaid reform to provide budget forecasting, that they know, predictability, so that they know exactly how much money they're going to have to spend. And also, as we know, that the Medicaid reform must have integrated care coordination. The state has contracted with a gentleman named Bob Atlas, who is a national consultant. And some of the items that he went over included a description that no one state has the perfect answer, and that it is up to North Carolina to really pick and choose the best practices from other states as we go forward. And the good news, I think, for us and other MCOs is that they want to leverage existing North Carolina grown assets, including LME MCOs, hospitals, and community care of North Carolina. So I think that really is good news, I think, to all of us in the public sector, that they're really trying to find a way that we can get the costs down in terms of administrative costs, more services to our people, but in a way that will use our existing service system. They are looking at a regional approach, and as we know from that when our state director visited with this board, I guess in August or September, that we know that the state is looking very strongly at a regional model, possibly 4 regions in the state. So that's been pretty consistent throughout the last couple of months. They are looking at open competition. Now, when I say that, I think at this point, and these are somebody else's notes who were at the meeting, I really think they're talking about the fiscal health side of the house at this time. They are looking to go live sometime between mid-2015 and 2016. I would like to add, I think a really positive thing is that the Secretary was very, very complimentary of the LME MCOs throughout the state. They know that we're trying very hard to work together to see if we can, what we can do from consolidation. And I think they recognize how hard this is. It's taken us a number of years to get where we are today, and we're talking about now 10 going down forward. So I think we still have a ways to go. I will tell you that at the third week of later this month, in November, I think November 22nd, the MCO directors, my peers, and I plan to really call for the vote, call the question, in terms of trying to come up with a map that we can put forward to our counterparts, to our boards, and to the state that we agree with. And we hope to get that done later this month. We feel very strong that it needs to happen sooner than later so that we can try to help settle the system down, at least on the behavioral health side. So at this point, I will tell you, I've sent you articles from Mecklenburg. It does appear that, that they are going to join Cardinal, but that, I don't think that final vote has been taken at this time. I certainly will keep you posted there. Any questions about that? Now, this was a meeting that was held by the governor and the secretary Monday or Tuesday, I guess Tuesday, maybe. Yes, Wednesday. Was it yesterday? I guess it was. Okay, just yesterday. Okay, so then today, there was a press conference, and Amy, if you don't mind, I'd like for you to talk a little bit about the press conference, because she and her husband attended as well.
Sure, so if I leave anything out, please help. It was a really great occasion at Wakebrook, at the Wakebrook facility in Wake County, which is a crisis services and other, like there are inpatient beds there, a recovery unit. And so the occasion really was for the secretary to come out and announce that they were going to really focus on a crisis initiative. So they chose the Wakebrook facility to make that announcement. Bill Roper was there, who is the head of the UNC healthcare system. And so the secretary introduced him, and he talked about all of the work that they're doing to make the services as good as they can be and to support Wake County in that effort. The secretary emphasized the need to move people out of emergency rooms, hospital emergency rooms, and they cited some statistics about how much increase there has been in utilization of emergency rooms over the last several years. And so what they're looking at is establishing what they call the scorecard to measure the change in trying to reduce the utilization of emergency rooms and recidivism for people going back. And that would be after implementing some of their initiative. Part of that was looking at EMS services, because in Wake County, EMS now is engaged in taking people in for the crisis center, rather than taking them to the emergency room. So they've demonstrated that they've saved quite a bit of money by diverting them from emergency care. So that was one takeaway message that I got. They also want to look at, models of crisis centers and whether that's something that they can expand across the state. Other than that, I didn't get any real concrete initiative.
I think they really want to highlight how critical crisis services are in the community. So that's why we really want to track how well we're doing. But a lot of it has to do with crisis collaboratives. And I will tell you, Wake County probably led the way in terms of having a long-standing crisis collaborative. I know that Durham has that now as well, and has really done some great work, both of them have. So I think they're really wanting to use that kind of model throughout the state. And again, they use Wakebrook as a good example, a good backdrop to that.
It was an interesting turnout because they had everybody there, law enforcement, elected officials, organizations, a huge turnout.
Thank you, Ann. Board members, any questions, comments in reference to anything stated? If not, we'll move to item 10, the RFP update. As most of you are aware, we're in the midst of RFPs or accepting RFPs. Actually, we work for intensive services. That process ended last Friday. And at this point, I'd like to ask Beth Melcher to come forward to give us an update on what we'll do.
I'm really just going to stand up and introduce Carlisle. This has been an amazing process, and thank you for all you folks who have volunteered or will be volunteering to assist us in reviewing those RFPs. We had a good response, and Carlisle's going to detail that for you. You will probably be hearing from some providers, and that's why we wanted to keep you up to date on where we are in the process and how we're proceeding. So I'll let Carlisle give you the numbers, and then we'd be happy to answer any questions that you might have.
And I want to talk a little bit about, come on, here?
That's fine.
Okay. I wanted to also tell you a little bit about the process as well. Just as a reminder, we have posted on our webpage requests for proposals for intensive in-home, community support team, substance abuse intensive outpatient services, and supported employment. And the first three that I mentioned, community support team, intensive in-home, and SAIP, are enhanced benefit services that, for which we have many providers. Supported employment is different in that it is a new service definition for mental health and substance abuse, and that is related to the Department of Justice lawsuit. So a lot of what we're talking about in the RFPs are primarily those providers that have been around many years providing Medicaid and state-funded services. We are asking that all providers, of those services submit an RFP in order for us to review their current qualifications to provide the service, and also to look at a broader spectrum of continuum of care in the local community. We're asking that the providers submit a plan to have not just intensive in-home, but outpatient services, psychiatric services, and a more comprehensive array of services. So we received 114 responses Friday, 9 late responses, and since that time have been reviewing them for minimum compliance. And we're looking for whether they submitted a response on time, the completeness of the response, whether they're in good standing with Alliance. We want them to be in good standing with other LMEs and federal oversight agencies. And we're looking at the basic ability, the minimum compliance with the expectations of the RFP. At this point, 95 responses met the minimum response. We are sending letters to those that did not respond and those that did not meet minimum response criteria. We'll be sending those out tomorrow, or expect to send those out tomorrow. You may be hearing from providers that they did not get their application in because of the weather, or that they are concerned that they got a letter and did not meet minimum criteria. And I want to let you know some of the reasons that we did not select them for minimum criteria. One is they have to have a credentialed site within the Alliance catchment area. So we have providers who have a credentialed site in another county in North Carolina and provide services for Alliance consumers who happen to live in those counties. So if your Medicaid card comes from Durham and you live in Mecklenburg County, you may be served by a provider that is under contract with us. We don't ask them to respond to the RFP. We didn't allow them to. And also, we will have out-of-network contracts with those where the consumer lives elsewhere and receives services in that area. However, we also have providers that provide services out of a credentialed site outside of our catchment area and drive over, drive up 85 or 95 or 40 to get to Durham, Wake, Johnston, Cumberland, and provide the service. We're not interested in continuing to have providers not having the continuity of care. We want to make sure that if you're providing community support team and you step a client down to a lower level of services of outpatient, they don't have to drive outside of our catchment area to get those services. So we've reviewed minimum compliance, and now we're starting a desk review process, and then we will follow up with interviews. For those who participated in the Wake interviews, I never thought I'd say this, but that was smaller than this. And we are doing this, we're proceeding in a sequenced manner. So we're first of all having staff mostly doing the minimum compliance review and desk review. Certainly, all board members and CFAC, we're asking for representatives and volunteers to review RFPs. We didn't think that you necessarily wanted to review 95 at this point. If you are interested in reviewing parts of those or being part of the process, we certainly welcome that. What we're wanting to do is to get to the point where we've reviewed the information provided and have a better sense of who is likely to make it to the interview process. And then we'll be setting up at the most 95 interviews, but hopefully fewer than that in the next month. We are checking references, checking with other LMEs, and we'll be asking good clinical questions in the interviews to make sure that the quality of the written content is matched by what's happening in actual practice. At this point, latest numbers are we have 20 applications for community support team, 36 for intensive in-home, 26 for SAIOP, and 13 for supported employment. And so we're breaking those numbers down by county. We do have sufficient responses, we believe, for each county in the area. We've also asked providers to let us know if they have an interest in expanding services into other counties. And we will consider that if we need additional expertise and services. So let me see, do you have any questions or feedback?
I do. And you alluded to at the very beginning, the date for these submissions were on Friday this past week. I'm assuming 5 o'clock. Were any proposals received after?
We had providers who came in at after 5 o'clock, and they signed an attestation. We asked them to sign an attestation acknowledging that they understood that the information was provided after 5 o'clock. We would hold that information in the event we do not have sufficient capacity in the network. We can consider those at a later date.
Right, so I have gotten a complaint as soon as I got this building today, but I want to talk to you, Ellen, before I address it publicly. But I'm glad you answered that part, because I needed some clarity in terms of understanding, did you not or accept any additional after that? So.
And actually, we had pre-proposal conferences for each RFP, and we emphasized in the pre-proposal conferences that we really wanted them earlier than Friday. We wanted providers to anticipate traffic, congestion, flat tires, weather, and that in order to be fair to all respondents, we have to set a time period to
Trust me, I believe you. I've said this before, you get some of the greatest stories in the world, but all I'm concerned about is we followed our process in regards to that. So I'll maybe get Ellen and then you all can convey.
I want to say, too, I was delighted to have our general counsel with us during the process. I don't appreciate it, but it was very helpful having Tracy overseeing, making sure that we were compliant with our process. And so we're keeping very good documentation.
Do you have a target for the number of providers in each category?
We do not. That's a very good question. Our intention is not to determine upfront that we need a certain number of providers in each community. We're primarily asking that they demonstrate that they're able to provide the service as expected, that they're a CABA, they're meeting the CABA expectations, that they have a properly credentialed staff, they have a medical director who's involved in the day-to-day operations. And so we're looking for quality. So if we get 100, if we have 95 quality providers, then we'll contract with 95.
Any additional questions or comments? I'm going to make a quick plug because I wasn't part of that Wake County RFP process. I actually found it very interesting because obviously I represent one disability area, and I had a chance to get involved in substance abuse and one of the RFPs, I believe, and it was enlightening for me, and I found it really helped me, and I hopefully am a better board member because of it. So just as a plug, even if it feels like it's a little bit of a time consumer, it's worthwhile.
Scott, can I make? I'm sorry, Beth.
That's an excellent plug. We do need assistance. We would love to have you join us. We are going through sort of a desk review right now, but when we start the interviews, we would love to have your participation and your support. Certainly welcome to look at RFPs now, but really when we get to the interview phase, we'd love to have a broader group participating. So if you are interested, email me, email Carlisle, and we'll get you signed up.
And believe me, board members, you all would love going through the notebooks. That was that was a great experience.
I have to say, this time we have one original, one copy, and an electronic version. So we're moving in a much more eco-friendly direction. It is still a very full room of RFPs with 2 copies.
Sorry, man.
I just like to say I served on that committee, and it's so enlightening, as well as a social opportunity to meet people working out in the
Yeah.
Can I make a request to Carlo and Beth that as you continue through this process and you identify potential dates for interviews and things like that or gatherings, can you please pass that to us so that you can get a better idea of who will be able to participate in the process when we can solidify a date? I think that'll help.
Real quick, I was going to add, I was in the Wake County process too, and I very much agree with you. I think it gives you a much better global view of what the organization is doing in these contracts and what our providers are capable of doing when we look at those contracts and those proposals. The other thing I was going to say is I attended, was it yesterday? The training, they had a staff training for me. I called it, whatever she's got, I called it. And I'll tell you, I probably don't even say this, it's a critical function that's being undertaken right now. And I want to say that y'all's team has really done a very good job to take an immense amount of data and sort of concentrate the critical elements of that in such a way that we can get involved. I think all of us actually should get involved.
Yeah.
Not everybody is going to be happy in this process. In fact, not everybody is happy right now with this process. So I think it behooves all of us to take a very serious interest in what is happening here. We will be hearing about it whether we are involved in the RFP process or not. With that said, there's going to be another training opportunity for boards, perhaps?
Yeah, I'd be glad to. And actually, I have a PowerPoint that I can send out to you. We've done a PowerPoint for the training, and we're certainly glad to have additional training.
Yeah, even if you're not going to have, if you don't have the time to actually be involved in that review, I would look at those slides because we will be getting questions about this process. Hopefully not in the courtroom, but we will be getting questions about the process. And I will tell you, I've looked at it. It's really good. I mean, y'all done an excellent job with it.
We are recommending this be put on the agenda for next month.
Oh, good.
So,
Okay.
so that everybody will have an opportunity.
Excellent.
All right, that's it. Thank you, Carlisle. Thank you, Beth. Well, actually, before I say thank you, Beth thought she was off the hook. However, I'm going to call Beth forward to give us an update on URAC. For those of you that may not be aware, the week of December 9th, URAC will be performing an audit of the Alliance. So Beth is going to give us an update on our preparation.
Yeah, so I'm going to pretend to be Lena. URAC is the accrediting body that we are seeking accreditation from. We are required as an MCO to be accredited from URAC or one other agency, but we're using URAC. We already are accredited for We have other functions that now must be credentialed, those being the call center and our provider networks. Ultimately, we also need to get accredited for our credentialing process, but this review right now is to look again at a re-credentialing of our call center and our provider networks. So we've gone through an exhaustive process of matching up what we do, our policies, procedures, our protocols, match up to URAC standards. We submitted all of our information in the beginning of October, have responded to really very few questions, which was good news. We had very little that we needed to send back to them. We're going through the process now of staff training, doing mock reviews with staff. We'll be doing that through probably right up to the time that they get here. So they'll be on site December 10th and 11th, I believe. Could be over to the 12th. They've held out that third day, but they're really hoping they can finish up in 2 days. Again, also good news for us that they're feeling right now, based on what they've looked at, that they can probably get this done in 2 days. So that will be exhausting for all of us, and we'll all be on pins and needles for the whole time, but I think we've really done our homework, and we'll have everybody prepared for that site visit. So happy that's where we're at right now.
Any questions or concerns? Board members will move to item number 12. Ann Osh is going to come forward to present a report on the progress of the Youth Opportunity Initiative.
Yes, just as a brief reminder, we brought this youth opportunity proposal in Durham to the board back in the spring, seeking your approval to proceed through the city of Durham, the county of Durham County, and Durham Public School System to jointly fund 2 positions located within our system of care department to redesign a continuum of services and supports for the most at-risk, high-risk, disconnected transition age youth. And Commissioner Page might have some additional comments about this. He was instrumental in helping us get through the final leg of this journey. And the proposal was a result of IBM's recommendations. Durham was selected from a handful of cities across the world as the Smarter Cities Challenge. And for those of you that are familiar with some of the social challenges of Durham, certainly high-risk youth who have become disconnected, in trouble with the law, poor life outcomes has been an issue where there has been a strong commitment from the community to do better. And so this was one of the solutions to get together and try to do something better than where we have been before. So we are very pleased and excited to begin. It will fund 2 positions, a youth services director and a youth opportunity coordinator. The youth opportunity coordinator is a young person with lived experience. So we are also very excited for the perspective of being able to employ a young person as part of this process. So we are waiting for some of the logistics of contracts and agreements and monies, but you did approve the 2 positions back in the spring, so we are going to move forward with convening our recruitment and selection committee representing all of our stakeholders and partners in this effort, and post the positions, and stay tuned. I don't know if there's anything you would like to add to that.
I'm just glad to start.
Me too.
And really, and I want to commend you for your patience and the way you represented the Alliance on this, because it was a lot of concerns and misinterpretations, in my opinion, on our board of what the role was going to be, and particularly our community. So our community weighed in on this as well. So you really, I just appreciate it. And here again, I'm just delighted that that's history at this point.
We can go on to getting the work done now.
That's right,
So,
exactly.
yes, we are very pleased to be at this point too, and that there was a favorable resolution. It is, I think, a testament to Durham that we had all of our local governments and school systems come together to jointly fund 2 positions and have the confidence and faith in Alliance to lead us through a community planning effort with this. So we look forward to reporting on that progress.
Thank you. Moving to item 13, crisis service presentation. James Osborne is going to be coming forward with a presentation of the continuing crisis services available across our region.
Thank you very much for having me. I'm also with the Community Relations team and want to provide you with a further update regarding our crisis continuum services. And I think the information about Woodbrook is a good start. Our crisis reduction plan has 2 major goals, which is to reduce the need for the emergency department admissions for people with behavioral health diagnosis, but is also priority number 2 is to reduce the number of consumers that are needing 3 or more crisis services within the 12-month period. The priorities are a part of our reduction plan that does go across all 4 areas of our county, and we also have site-specific goals. This is also one of the major parts of our local business plan, which is reduce crisis events. We are reaching these priorities through 6 specific goals, and the goals to reach the priorities is to overall, again, decrease the use of the emergency room admissions, We also want to continue to develop and nurture our crisis intervention team law enforcement CIT program. And we also want to increase the availability of our crisis assessment services and referrals. The fourth goal is to increase the use of our facility-based crisis programs, and also it would include our non-hospital medical detox programs along with our mobile crisis teams. We also want to increase the use of our first responder activities, which is part of our enhanced provider responsibility. And of course, we want to reduce, again, readmissions of individuals to our psychiatric hospitals. This is our continuum of crisis services. We are able to reach our goals through using the continuum of crisis services. We also are able to reach the goals through implementing initiatives, which I'll come to in a moment. As mentioned about the first responders, these are the enhanced service providers, and they have a responsibility to be the ones responding to their own consumers when they are experiencing a crisis. We believe, again, the critical relationships that have been established there. We also have our crisis intervention teams and the officers, law enforcement officers that are a key community partner, along with the mobile crisis teams. We're very proud of how we've been able to embed the Alliance care coordinators. It's been a big part of the crisis continuum because they are actually within each of the crisis assessment centers. We're also working through the facility-based crisis, like the Wakebrook facility. And they're also in the emergency departments, and that has been quite a challenge for us in being able to get individuals actually within the hospital systems so that we can work more closely with our individuals that have behavioral health issues. We have our crisis assessment centers for Wake and Durham. Those are open 24 hours a day. And down for Johnson Cumberland, they're Monday through Friday, 8 to 5. And then we have the facility-based crisis and detox services for Wake, Durham, and Cumberland. The emergency department is on the list, and again, we do end up using that as part of the continuum when all of the other options have not been able to manage the individual in a more community-based type of setting. Then we still have to rely on that as a last resort. So I'm going to give you just a brief update about each of the services, or many of those that are in that list of continuum. Mobile crisis teams, they're, again, 24/7, so they're available 24 hours a day to individuals that are consenting for that mobile crisis team to come out. We've been working very closely with our mobile crisis teams and bringing them together so they can compare notes and work more collaboratively together. We also have integrated them into other service providers and making sure they're familiar with our crisis assessment services and also with our law enforcement agency. One way that we have been able to make some improvements in their increase of utilization is by having them meet with our law enforcement agencies. And we've had law enforcement now have their phone number so they can call them directly. Many times our mobile crisis teams were dispatched out of our assessment and call center. And now they can call law enforcement directly, and then once they're on the scene, and they do respond to law enforcement when they call, and so that gives the person a better response time. And then once they're on the scene, then they're able to work on getting the consent of the individual, and that's helped with just a smoother transition and helping us again bridge our partnership with the CIT program. We're very proud of our CIT program. We have recently had our awards banquets for both Wake and Durham in the last month. Very proud that Wake NAMI started the first CIT program in North Carolina in 2005. It's been used as a model. Other counties have come and looked at what they're doing and have, and every CIT program is really collaborative. They want to share. The program down in Cumberland has been very helpful in helping the program up in Johnston County. So really, all of our programs work very closely together. Each of these programs also have a leadership group that comes together that involves law enforcement, NAMI, volunteers, and the Alliance staff. And we all work together to look at the curriculum and see how we can improve. We also want to continue to be collecting data from our CIT reports. We need to prove that these interventions are effective. And again, this is one of several jail diversion types of efforts where we want to focus on getting individuals to treatment versus incarceration when possible. The crisis assessment centers, we have Durham Center Access in Durham. That facility did experience a decrease in utilization back when you compare fiscal year 12 to 13. And anytime we see that one of our services not being fully utilized, we get involved, and so we're meeting with them on a monthly basis to start looking at what kind of issues might be contributing to that and how all of the other systems are interfacing with those admissions. For Wake, as we talked about, we have a relatively new to that position, kind of as far as UNC being there since July, and quality management and ourselves are meeting with them on a regular basis as we start collecting their data and start looking at important issues about, for example, their going on diversion and how frequently is that happening and how are they interfacing within the larger Wake County system. For Cumberland, we're excited about the Roxy Avenue Center. They've been working on getting that drop-off center available for about 4 years. And it's very close. They're, again, tentative date now, the second week in December is what I'm told, that they'll be able to have that available. At that Roxy Avenue Center, they already have the facility-based crisis and the detox center, but we're, again, looking at an alternative for drop-off for the law enforcement officers versus them having to take them to the emergency department at Cape Fear. So in addition to those continuum of services, we also have some initiatives, ways in which we have put some programs together that we think would also make a difference. One of those is the open access appointment. This is got started with Monarch in Wake County, where the individuals are able to walk in and get the assessment and also have a psychiatric assessment completed so people walk out with a prescription in their hand in the same day. That's something that we've been working towards for many years. And once you kind of set the bar and put that in place, then other providers are now starting to look at ways in which they can follow that same model. Also have had same-day appointment capacities if people make an appointment and see someone the same day with other providers. To reduce the ED admissions, overall the data is showing that we are having less ED admissions when you compare the fiscal year 13 to 12. And again, we believe that the care coordinators being co-located and embedded within the emergency departments is making a difference. For Durham, they have individuals that are employed both by the Duke University Medical Health System and Alliance that will give them access to information. For our Wake system, they've been hospitals there have been willing to privilege and credential individuals in order to have them be more embedded directly in that system, and that makes a difference. As we also expected with Strategic Behavioral Health, a psychiatric residential treatment facility in Garner, that also has helped to give us some more options for youth instead of having them going into the crisis system. First responders, quality management did a study of them back in August, and they found that 89% of the calls left on the voicemail systems for these individuals were returned by a qualified professional. So that system is responding to the individuals. And also then once for 95% of the calls, the volunteers rated the staff as being courteous, and 89% of those calls were rated as being helpful. Again, any kind of data that we get about the network then gets fed back to our Provider Advisory Council for their feedback. In Durham, we mentioned previously about the Crisis Collaborative and the Top 25 pilot that they did along with Duke, and they, again, focused on the top 25 individuals that were crossing all of these systems. And they studied them for 6 months, and through using intensive care coordination efforts, it's proven to be effective in that they were able to have a 69% reduction in their use of services, and when they did the cost savings across systems, it was $186,000. But they're going to continue that for another 6 months, so we'll be excited to see if that is able to continue. New initiatives, things that we have only recently implemented or are in process of putting into place that we're excited about. The assertive engagement program for Durham, we're using a provider to work with individuals that are transitioning out of incarceration that have behavioral health issues who need housing. Housing is a critical component for individuals that are coming out of incarceration. And so they're able to work with certain individuals that, again, have a high risk, high cost recidivism and are able to help with that engagement. We are also excited about putting into further develop our specialty courts. They've been working in Wake County for many years to get a mental health court in place. In Durham, they're working on a vet court. These courts are very important. They're part of a sequential intercept model at places where we can intercept and work with people that have behavioral health issues and also are intersecting with our criminal justice system. So we're really excited about, again, another opportunity. If we can't divert them on the front, how these courts can also help to get individuals connected to services. And then QM is also putting together a hospital admission and readmission work group to also look at that data. appreciate the opportunity to present and look forward to being able to bring back again more data in the future regarding these new initiatives and the ones that are in place. Questions?
Thank you, James. I'm sorry.
Yes, we offer our kudos for all of the work that all the staff's been talking about this afternoon.
Thank you, James. Board members, I'm not sure what to say. This makes 2 months in a row that we went quite early, and I apologize to everyone. I'm not sure if you heard my comments from last month.
Well, this certainly disproves it.
Exactly. So I actually have a new reason now. You all are on your best behavior because Cumberland County has joined or merged with us. So we actually should have done this much earlier. So thank you. Board members, if you're agreeable to it, we stopped Monica a bit early, but since we have so much more time, we allow Monica to come up to continue the board policy training.
You want to adjourn?
This is a prank, right? You did this on purpose.
Yeah, we have to be here. We have to be here.
They didn't adjourn, did they?
Gone home, I had a chance. All right. I think we